Greetings, my name is Mark Angeloni and I'm a member of the class of 2013 at UConn School of Dental Medicine. My pathway to dental school and career of dentistry is probably a little bit different than some people's could be. I studied mechanical engineering in undergraduate at Union College, and I decided around my junior year that engineering itself may not be the exact type of profession that I wanted for myself in the future for a few reasons. And I explored my options, thinking medicine, orthopedic surgery, dentistry, and I even ran the gamut into law. But I really decided that I wanted to have the personal relationships that doctors and dentists have with their patients and the people that they're treating. And during my senior year at Union, I decided that it was dentistry that I wanted to pursue. I did an internship which provided me with a lot of exposure to dentistry, oral surgery, orthodontics, pretty much everything. And I thought that I could find my way in one of those professions. I've always had a great appreciation for oral hygiene, oral health. I had very good teeth my entire life, whereas my sister didn't, and I saw how she struggled with that, and it gave me a greater appreciation for it. And being able to make a change in someone's life like dentists do every day, that was very gratifying and inspiring, and that was definitely the inspirational aspect of it and the patient interaction aspect of it really drove me towards dentistry. Since I was a mechanical engineer undergrad, I continued with that, and that was what I achieved my degree in. But because of that, I didn't take a number of the prerequisites for dental school, so that kind of forced me into taking a post-bac year or two. I completed my studies in biology, organic chemistry, biochemistry, and all the other prerequisites that I hadn't obtained in undergrad at UMass Amherst. I was from a nearby town, so it was an easy commute for me. And I entered the program as part of their second bachelor's degree program, and then just completed 1 year of study there, which was very common and is something that the pre-med advisor at UMass told me was a fine option. I know that there are a number of post-bac programs specific to people in my circumstances where I didn't have the prereqs for entering dental school or med school. I have a friend from home who's attending UPenn for a program like that, and I know there's a number of other programs like that as well. It wasn't much of a transition for me going from mechanical engineering to continue my studies in sciences. I've always enjoyed sciences in general, part of the reason why I went into mechanical engineering, and the demands of the mechanical engineering program and the curriculum at Union really helped me and with my work ethic and everything to be able to complete the post-bac program, which was very exciting to be with younger students, because a lot of my classes were full of freshmen and sophomores, so that was fun and interesting. But knowing what I wanted at the time made me a little bit more, should I say, serious of a student, and kind of separated me from the other students, which I found was definitely respected by the faculty there, and it was a good experience for me. And since I believe it's more common for people to come from a background that's not necessarily biology or chemistry, where you're going to gain the prerequisites in undergraduate going into dental school or med school, that it's more common and well received. That's a difficult question for me to come up with a specific answer to, but my advice along that vein would be to enter dental school with a complete open mind to everything, learning aspects, living aspects, absolutely everything. Enter with a hunger for learning and trust in the system that everything there is done for a reason, although sometimes you might not be able to see that reason. Down the road you understand why things were done the way that they were done. Entering dental school with that mindset of a hunger for learning and an open mind really makes the experience far less stressful for you than it could potentially be. I've noticed that for me personally, entering with that mindset has really been a great experience for me, and I know for other students who didn't necessarily enter with that same idea and mindset has led them along a more stressful journey through dental school. As an undergraduate student, it's definitely very difficult to make such an enormous decision as to what you're going to do with the rest of your life. So my advice is to consider all your options, and in considering all your options in your studies in undergraduate, work as hard as you can, learn as much as you can, and do as well as you can, because you always want to maintain all of your options. You don't want to not do as well as you could have, which could close close you off from some opportunities that you would later realize that you wanted, but you've compromised yourself earlier on. So no matter what it is you want to do, just work hard and do as well as you possibly can. Dentistry and any profession in general, if you're considering them, my advice would be to get as much exposure to the profession as you possibly can. Talk with as many dentists as you can, go to as many dentist offices as you can, general dentists, the specialties, all of them. Just get absolutely as much experience as you can so that you know when you're making that decision, you've prepared the best that you can for that decision. And you know that you'll be making the right one, or at least you'll hopefully be making the right one. Adding to that, personally, don't feel like if you're making the decision later than the ideal student that the option is closed off from you. Initially, for me, when I made the decision and I knew that I was going to have to wait 2 years between graduation and entering dental school, I thought to myself, oh no, I'm going to be behind. But then quickly I came to the realization that there's no one for me to be behind. We're all on our own individual paths to our ultimate goal. And don't let the fact that you might be not the ideal age for entering dental school affect your decision in any way. First of all, and most importantly, I would say working in the dental clinic and actually working on patients is a very, very exciting and very, very gratifying experience. To be able to use what you've learned the first couple of years in the classroom and in preclinical lab, to be able to actually use that on a person to be able to improve their oral health, their oral standing, and that's definitely the most important thing that I could say, is that it's very, very exciting, very gratifying, especially when the patients, for the most part, the majority of them really, really appreciate the work that we do here. And that's really, really gratifying and inspiring. And then to add to that, it's definitely a change of pace and can definitely be stressful because you're working on a real human being. You're no longer working on a typodont with plastic teeth, and you're treating a real person. But like any other challenging experience in your life, you prepare the best you can for it. You enter with confidence and you perform to the best of your ability, and what happens, happens. And usually if you prepare properly, the outcome is generally good and well received. It's also very enjoyable working with the clinic faculty. Some of the clinic faculty aren't necessarily people that you see in your preclinical work, and they offer a real life side to treating patients and treating a tooth. For an example, when you're in preclinical lab, the focus is on the ideal cavity preparation, because there is an ideal, but when you're working on a patient's tooth, those circumstances aren't necessarily ideal, so you have to work with that, and you use the steadfast principles that you've learned for the ideal, and you work off from that. And the clinical faculty and the perspective that they have really, really helps and adds another nice layer to your dental education.